As families travel and gather for the holidays, doctors are keeping a close eye on a new flu strain spreading overseas that may soon hit the U.S. hard. It's called subclad K, and experts fear it could fuel a particularly nasty flu season. Meanwhile, norovirus cases are surging with test positivity climbing rapidly. So joining us to tell us more about it is Dr. Steve Goldberg, Chief Medical Officer at HealthTrack RX. Good morning, Dr. Goldberg. How are you?
Great to be with you. Well,
Good. I'm so glad you're here to talk about this again. Very timely topic with that cold season fastly approaching. Now, what makes this new subclad K strain that we're talking about different from what we've seen kind of in recent years?
well, every year, the World Health Organization puts a plan together for vaccines. And they pick 3 vaccines to be in the immunization folks get in the fall. This one wasn't in that mix. It emerged during our flu season. And there's some concern about the match between the vaccine that's prepared and this particular bug. The importance, though, is that there is great coverage by the vaccine for this subclade organism, and that if you have been vaccinated, you're less likely to get serious complications, such as a hospitalization or death. So vaccines are still important, even though it wasn't a perfect match.
And so, like you said, current vaccines do offer protection for this strain, correct?
Current vaccines do offer protection for this strain. Yes, they do.
And who would you say is the most at risk when it comes to this new flu strain? Is it kind of everyone, or is there a certain category of people that need to be, very cautious when it comes to this strain?
Yeah, everybody should get vaccinated. And in particular, people that are older, if they have asthma, if they have heart disease, if they have lung disease, if they're pregnant, if they're young, those are groups that are much more likely, if they get the flu, to need to be hospitalized or sadly have death. So that's why the vaccine is really important.
And so what about if people are vaccinated, what other steps can families take this winter season, holiday season, to prevent the norovirus from spreading in their home?
Believe it or not, number 1, number 2, number 3 is washing hands, washing hands, washing hands. That's really highly effective to stop transmission. And then certainly covering your mouth when coughing, not going to school or work if you're ill. And there are certain things that might shorten episodes, vitamin C, zinc, and my favorite, chicken soup.
I had some chicken soup myself when I was out sick, and it definitely helped with that kind of sore throat. Now, do any of those preventions that you talked about, do any of them make the biggest difference when you're, say, heading out to a holiday event to go see family? Or is there, take the cough drop, take, the vitamin C and the zinc before you head to a party?
Yeah, those are all really good choices. The hard thing to confront, though, is if you're ill, you're probably best not to go to the party, to stay home and rest. That, especially if the guests there will be in high risk groups, older, asthma, heart disease, lung disease, pregnant, and the very young. It's hard, but that's probably the best thing to do during flu season.
And so we know sometimes, some symptoms are harder than most. So when should people maybe cancel travel plans due to their symptoms? Is it when you start to feel that scratchy throat? Because it could be, maybe it could be allergies that you might be confusing with the cold. When is it time to say, okay, I'm not going to go at all?
It's a real judgment call, and it's hard, especially if people saved up money for trip and put plans together. I would say if you've got persistently high fever, if you are unable to keep yourself hydrated, if you have other GI complaints, then it's probably best to think about canceling the trip.
And then what about if you're the one hosting a party? I know you said make sure you're washing your hands, but how can hosts also make sure that their gatherings are safer this holiday season and not kind of a breeding ground for, all sorts of diseases, infections?
Wow, what a hard question. The reality is that one of the reasons that flu is so prominent this time of year is because families are getting together, friends are getting together, and that creates the environment for spread. So what I would say is that in general, if folks are ill, you should disinvite yourself from attending a family gathering.
And we know during kind of the pandemic, we saw masks were utilized heavily. Are masks or improved ventilation still helpful during peak flu and norovirus seasons?
Absolutely. They are very helpful. That said, they're in a list of things that people can do. So first and foremost, if you're ill, isolate. Don't go to work and stay at home. The second, wash hands. The third, take care of yourself. Be well hydrated, eat nutritious food, get rest, take things for discomfort. And then finally, some of the other things that we mentioned could be helpful, such as vitamin C, such as zinc, such as chicken soup, all of those put together. But in general, if you're ill, best to stay at home. And if you haven't been vaccinated, go ahead and get vaccinated.
Perfect. Well, Dr. Goldberg, some really amazing tips. Hopefully our viewers are walking away a little bit safer this holiday season when they go to visit family. And hopefully, if they aren't feeling well, they learn to stay home. We appreciate your time this morning.
You bet. Happy holidays.
You as well.